Hi, I'm Carolyn Honia, a lactation consultant and owner of Lake Norman Breastfeeding Solutions. It's that time of year again. Almost everyone we're talking to has recently been sick. Cold, flu, COVID, strep throat, it's all going around right now. And we're getting a lot of inquiries about what breastfeeding mothers can or cannot take while nursing and feeling sick. So we wanted to talk to you today about what your options are. First, let's start with what not to do. Unfortunately, many decongestants and antihistamines have the risk of reducing milk supply. If you think about how they work, imagine the congestion that you're experiencing and taking a medication intended to dry up those mucus secretions. Unfortunately, for some women, that effect can also dry up your breast milk, which in some ways is also a secretion. And so we're very cautious about moms using decongestants or antihistamines while breastfeeding. There's a few exceptions to that, primarily women who have high milk supply and are more than a couple weeks postpartum may be able to safely take it, occasionally monitoring for any changes. So instead of using those medications, which would be most of the ones marketed as cold and flu drugs, instead we want to use something that thins the secretions instead of drying it up. So the best example of that would be Mucinex with the single active ingredient. This is a generic version of it. The active ingredient is galphanesin, but it's commonly called Mucinex. So here's one example, mucus relief. And what Mucinex does is it thins out the congestion, and so that way it's not going to clog up your sinuses as much. In your chest, it's going to be easier to cough out. Take it with a big glass of water. It works better that way, and it will not dry up your milk supply. So that's when you could safely take for the duration of your illness. Of course, with anything I recommend today, please check with your doctor, your healthcare provider who knows your personal health history and what other health conditions or medications you're taking. Another medication that's safe for breastfeeding is ibuprofen. And ibuprofen not only works as a good pain reliever, but it also reduces inflammation. And that is very helpful for congestion. Your sinuses can be inflamed and swollen, making that feeling worse. So pairing the Mucinex with the ibuprofen is a great combination. Safe for milk production, safe for baby, and of course can help with fever, pain, or body aches as well. And then a few other suggestions. Try saline mist or rinse or a nasal spray or neti pot to clear out your sinuses. This one you can find at almost any store and is a little bit easier to use than a neti pot. You just spray, let it sit for a minute, and then gently blow your nose. And finally, if you're having severe congestion and those other strategies aren't working, another option would be something like this. This is Afrin nasal spray. It is a decongestant, but because it's a nasal spray, that decongestant is going to stay local to your sinuses. It's very effective at relieving congestion for several hours. It's only recommended to use for 2 or 3 days, so read the label carefully and use as directed, but it can be helpful if you have really severe congestion and the other strategies aren't working. Finally, I want to mention that most of the holistic supplements and vitamins used to support your immune system when you're sick are usually safe for breastfeeding as well. For example, elderberry syrup or gummies are safe for a lactating mother to take. And then also supporting yourself with electrolytes can be very helpful when you're breastfeeding. When you're sick and you're breastfeeding, getting dehydrated happens really fast. So something like Gatorade, or this one is my preference. This is Liquid IV. It's a powder that you add to your water, can really help keep you feeling better because you're hydrated, and that will also support your milk supply. When moms are sick, they sometimes will have a small dip in milk supply, when they're not feeling well, but a lot of times that can be corrected by getting you hydrated with electrolytes. So maybe once or twice a day, drink an electrolyte beverage or liquid IV, and that should go a long way. And then finally, I just want to encourage and remind you that it is safe to continue breastfeeding when you are sick. And in fact, it's recommended. When you are nursing, your body is picking up from your baby what kind of immune support and antibodies your baby needs. And it's going to put that protection into your milk for your baby. And studies show that here in the US, breastfed babies are far less likely to be hospitalized from common illnesses than formula-fed babies because of that amazing immune support they're getting from you. So keep it up, mama. Ask for help as much as you can. Try to rest in bed with baby and stay hydrated. And we hope these tips for what medicines are safe to take are helpful to you.